Hey, have you ever wondered about the differences between hyperkalemia and hypokalemia?
Yeah, I've heard those terms before, but I'm not entirely sure what they mean. Are they related to potassium levels?
Exactly. Hyperkalemia and hypokalemia both involve abnormal levels of potassium in the blood. Let me break it down for you. Hyperkalemia refers to high levels of potassium, while hypokalemia is the opposite. It's when potassium levels are too low.
Oh, got it. So, why does this potassium thing matter?
Potassium is crucial for various bodily functions, especially nerve and muscle cell activity. When the potassium levels are off, it can mess with the electrical impulses in our bodies.
Interesting. What are some symptoms of hyperkalemia?
Symptoms of hyperkalemia can include muscle weakness, tingling sensations, and even heart palpitations. In severe cases, it can lead to cardiac arrest.
That sounds serious. What about hypokalemia? What signs should we watch out for?
With hypokalemia, you might experience muscle cramps, weakness, and fatigue. It can also affect your heart rhythm, causing palpitations.
So, how do these conditions happen? What causes them?
Good question. Hyperkalemia can be caused by kidney problems, certain medications, or even excessive intake of potassium supplements. On the other hand, hypokalemia can result from issues like excessive vomiting, diarrhea, or certain medications like diuretics.
Is it treatable?
Absolutely. Treatment usually involves addressing the underlying cause. For hyperkalemia, it might include changes in medication or dietary adjustments. Hypokalemia can be treated with potassium supplements or by addressing the root cause, like treating vomiting or diarrhea.
Thanks for breaking it down. I've got a clearer picture now.
No problem. It's always good to understand these things, especially considering how important potassium is for our bodies to function properly.